Hi everyone, and welcome to the Birds and the BBV Bites. On the menu today we have HPV on a stick, and your chef today is myself, and my name is Veronica, and I work at the Aboriginal Health Council of WA as Sexual Health Project Officer. Before we begin, I would like to acknowledge the traditional custodians whose ancestral lands we are gathering on here today, the Whadjuk people of the Noongar Nation, and acknowledge the deep feelings of attachment, relationship, that Aboriginal people have to their culture, to their country and to their waterways. I wish to pay my respects to all elders past and present and extend that respect to all Aboriginal people that have joined online today. So in this bite, we're going to yarn about the anatomy of the female reproductive system. We're going to look at cervical cancer. We're going to talk about HPV and the human papillomavirus, cervical cancer prevention through the HPV vaccination and cervical screening. And then we're going to look at the National Cervical Screening Program and talk a bit about self-collection. So looking at the anatomy of the female reproductive system. So here's one I prepared earlier. Okay, so we have the right and the left fallopian tube and the right and the left ovaries, the uterus here. Okay, top of the uterus called the fundus, and the lower part of the uterus called the cervix. Okay, so the cervix is about 3 centimetres long, 2 to 3 centimetres long, really firm, feels like the end of your nose, an incredible part of the female reproductive system. It's a very muscular. It has the ability to thin and stretch during labour and delivery. And then after delivery, it also goes back into its pre-delivery state, and it becomes a thick, sort of tight muscle again. And that's really important. So there are cells on the outside of the cervix called squamous cells, and they're the ones that we're going to be mainly talking about today. The inner cells are called the glandular cells. So cervical cancer is largely preventable, and up to 90% of the most common form of cervical cancer actually occurs in the squamous cells, which is the outer layer there of the cervix. And these cancers actually can be prevented by having regular cervical screening. Um, Most people who have cervical cancer may not even know that they have it. There may be no symptoms. However, later stages, symptoms can present. Symptoms such as abnormal vaginal discharge, abnormal bleeding, maybe spotting in between your periods. You may have pain during intercourse or sort of lower pelvic pain. You might notice that your periods may become heavier, and they can be some signs later on. But for many women, particularly in the earlier stages, will have no symptoms at all. So how common is cervical cancer? Well, worldwide, it's the fourth most common cancer in women. In Australia, it's the 14th most common cancer. And in Western Australia, 88 women were diagnosed with cervical cancer in 2017, and 20 women died of cervical cancer in 2017. The National Cervical Screening Program, or what was called the Pap smear program, actually began in 1991, and we've actually seen cervical cancer almost halved, since the beginning of the Pap smear program back in 1991. So it's been an incredible an incredible move to be able to provide a screening program that has actually halved a cancer found in women or people with a cervix. Over 70% of women who develop cervical cancer in Australia have either they've never had a pap smear or cervical screen, or they don't screen regularly, which means that they're late for their cervical screens. For Aboriginal Torres Strait Islander women, we can't currently measure how many women have actually participated in having cervical screening. The pathology forms, it's not mandatory to tick the Aboriginal Torres Strait Islander box, but definitely evidence is available that shows that Aboriginal Torres Strait Islander women are underscreened. And we do know that Aboriginal women have more than twice the incidence of cervical cancer in comparison to the general population, and also have 4 times more likely to die of cervical cancer than non-Aboriginal women. So it's definitely something that we really need to be aware of, and we need to be really encouraging women who come into our Aboriginal medical services to have a cervical screen. So what is the link between human papillomavirus and cervical cancer? So HPV, there's over 200 different types of HPV. It infects both men and women. It is one virus that the immune system can actually clear itself, which is pretty amazing. A lot of viruses we can't clear, but this virus we can actually clear from our system. It takes about 1 to 2 years. It causes nearly all cervical cancers. So there are different types. As I said, there are over 200 different types, and they are numbered. So types 16 and 18 cause 80% of cervical cancer in women and 90% of HPV-related cancers in men. It is spread through sexual contact, but it is also spread through genital skin to skin. So condoms will often provide little protection. So once young people start to become sexually active, they can actually pick up a type of HPV. And the more partners that you have, perhaps the more different types of HPV that you could pick up. There is also HPV that causes genital warts, particularly numbers 6 and 11. They are not a high risk for a cervical cancer type of HPV. However, they are a lower risk, and we would still also check anybody who has those types of HPV as well. Because of the Gardasil vaccination, which actually has 6 and 11 for genital warts, and it has 16 and 18 for cervical cancer, it also has 5 other types in the vaccination as well. So we've definitely seen genital warts rates go down incredibly. In fact, it's quite astounding that the impact that the Gardasil vaccination has had on genital warts, and also the impact that it's having on the rates of cervical cancer. So it's a really, really important vaccination for young people. As I mentioned, HPV is not only related to cancer of the cervix, but also other cancers. So other cancers such as cancers of the throat or the back of the throat called the oropharynx, cancers of the mouth, other genital cancers such as anal cancer and penile cancer, vaginal cancer, and also cancer of the vulva, which is like the outer layers of the female reproductive system, like the labia. So here's a picture taken of a cervix. when somebody's had a speculum put inside the vagina and that they've had their cervix viewed. So the cervix on the left is a normal, pink, healthy, moist cervix. And then the cervix on the right, you can see there's some abnormality there on the cervix. That person actually did have cervical cancer. So those cells were taken from the cervix and checked, and that was cervical cancer. It doesn't always look like that, but that definitely shows that there's abnormality on the outer part of the cervix. So when we look at human papillomavirus and how it could progress to become cervical cancer, how that works is, you become infected with HPV. You don't know what type of HPV that you might have picked up. As I said before, you can actually clear your HPV infection in about 1 to 2 years. Now, some people actually may not clear their HPV and HPV could persist. And when it persists, that's when it can have an effect on the squamous cells of your cervix. So then you can get those abnormal cells developing. If the abnormal cells keep developing, then they can actually become more cancerous type, and then the cancerous cells can become more invasive, which means that they can actually go from the cervix up inside the uterus. They may spread to the vagina. They may spread outside the uterus into the pelvic cavity. They can then get picked up in the lymph system through the lymph nodes, and that's where they can travel to other parts of the body. So you can end up with like a stage 4 cancer where the cancer has actually spread. And there's a picture of just how cervical cancer can actually spread from the cervix to other parts of the body. So how can we prevent cervical cancer? So primary prevention, firstly, is this wonderful vaccination called Gardasil, and it's available to all Year 7 girls and boys. It is 2 vaccinations in the school year and around 6 months apart. Secondary prevention is our cervical screening program, and this is for all people with a cervix. So you commence cervical screening at the age of 25, and the screening program actually finishes at the age of 74. It's every 5 years. So the school-based vaccination program, which is our primary prevention against cervical cancer, or our primary prevention, apologies, against HPV that can cause cervical cancer, and also other cancers that we talked about. So this is given in Year 7. It's the 2 doses. Now, what we're finding is that a lot of kids are actually missing their Gardasil vaccination. So a lot of kids go, oh, it's the day of the needle, I'm not going to go today, but not really realising the importance of these vaccinations. It's really important that if the school doesn't have a catch-up program, then we actually catch those kids up ourselves at our clinic. So for all clinicians out there, ensure that you've got some Gardasil in your clinics, in the fridges, and make that like a routine check when you're talking to young people and also with families around making sure that they've had both their Gardasil vaccinations, because we know that it's going to protect them from 16 and 18, which cause 80% of cervical cancer, and also other cancers that will also protect the boys. And the other thing is it will also protect them against 6 and 11, which cause 90% of genital warts. So it is a wonderful, wonderful vaccination that will give them great protection. So this is just showing that a lot of kids are missing out on their Gardasil vaccination. So the green bar is Aboriginal Torres Strait Islander young people, and the blue line is non-Aboriginal. So, you know, around, for some places, it's actually less than 50% of young people. And in fact, some of them are less than 40% of young people are actually having their vaccination, which means 50 to 60% of young people in some areas are missing out. All right, so we're going to look at the cervical screen, once known as the Pap smear, and it was called the Pap smear because of this fellow here. His name was George Papanicolaou, and he actually discovered the way that you could actually diagnose abnormal cells on a slide, and that was back in 1941. But the actual screening program commenced many years later. So a cervical screen, it's actually done using a speculum. So this is a speculum here, and the speculum is put into the vagina and opened up, and then we can actually through there see the cervix, as you can see on that picture. So once you actually view the cervix, or not you, but the health professional doing the cervical screen, be pretty hard to do it on yourself unless you're very flexible. Anyway, yeah, so the health professional would do the cervical screen by popping in the speculum. Then once they view the cervix, they wind this little thing in like that, and that actually holds the speculum open. They pop a little brush in, and what they do is they sweep around like this over the cervix, gathering the cells from the cervix. So they get some cells just from inside, and then the rest of the brush sweeps over the outside of the cervix, hence the shape of the brush. Once the cells are taken from the cervix, this is released and taken out gently. The cells are then put into some fluid and they are rinsed. So the cells actually disperse themselves into this fluid. So once the cells are taken from the cervix, they are in this sample. This sample is then sent to the laboratory, and the laboratory checks this sample for HPV. If there is no HPV in this sample, the woman or the person with the cervix does not need another screen for 5 years. So that would be what we call a low risk cervical screen. There was no HPV and therefore no need for another screen for 5 years. Okay, if that person had HPV in their sample, they would then take the cells out of the sample, put them onto a slide and look at them under the microscope for any abnormality, because we know that the main cause of abnormal cells that could become cancerous is HPV. So therefore, if the sample has HPV, they then take the cells out and they test the cells and they have a look at the cells. Now, depending on that result, the person will either be referred for to a gynecologist for a colposcopy, and a colposcopy is a similar sort of procedure to what I've just showed you, but they also use a colposcope. So they actually look at your cervix very, very closely, and they put a special solution on your cervix to stain it, and that will actually show up the abnormal cells. Excuse me. It's not COVID. Yeah, so, and yeah, I was talking about the colposcopy, that's right. And then that will then determine when you will need to be seen again and be checked. Not everybody needs to be referred for a colposcopy. Some people will just need to come back a little bit earlier than the 5 years and be rechecked again. Okay. So this is going back a few years now, but I've just to sort of remind everybody that in December 2017, we had a renewal of our cervical screening program. So what was the pap smear is now called a cervical screening test. And what we used to do is take cells from the cervix and put them on the slide and check for any abnormality. But what we do now is, because we know what the cause of cervical cancer is in 90% of cases, we now check for HPV. So we now check for the cause of the abnormal cells in the cervical screen. So instead of every 2 years, we now do it every 5 years. And we've actually don't start doing screening until the age of 25, and we finish at the age of 74. Now, many people will ask, well, why do we start so much later when we know that young people are having sex and probably picking up HPV a lot earlier than that? Well, there's a few reasons. One is cervical cancer in anyone under age 25 is actually very rare. We do know that for an abnormal cell to become cancerous, it takes about 10 to 15 years. So having a cervical screen commencing at the age of 25 and then every 5 years definitely would give time to actually pick up any abnormality that could become cancerous later on down the track, so that we can provide, so that treatment can be provided. The other thing is too, in the old scheme, um, women may have been treated unnecessarily, so their cervix may have had treatment on it, that if that person had the HPV and was given the time to clear the HPV, they may have then gone, all their cells, everything gone back to normal within that 1 to 2 year period, and they may not have needed to have that actual treatment on their cervix. So this way, it actually does give the body time to clear itself, and then we would still know by checking, doing the cervical screens, whether or not the abnormality has persisted or the HPV has persisted. So I hope that sort of makes sense. So there are reasons why the cervical screening program now commences at age 25. If a health practitioner has a young person who started being sexually active very, very young, and they feel it would be important for this person to have a cervical screen, then they can go ahead. That's absolutely fine, and they can do a cervical screen before the age of 25. But the actual screening program itself doesn't commence until 25. The other thing that's new since December 2017 is the self-collection. So where a person can actually take their own collection of a swab from the vagina for HPV, and we're going to talk a bit more about that. So this is the swab, the self-collection swab. So it's actually just got a sort of a soft foam end on it. Okay, and the person actually can do this screen themselves, and it goes back into the container. So at the moment, you have to be over the age of 30. You've never had a pap smear or cervical screen, or you're more than 2 years overdue for your cervical screen. From the 1st of July 2022, so coming up very soon, this self-collection is going to be available as an option for every person or every woman or person with a cervix. So it's absolutely fantastic that all women can actually have the option of doing their own HPV swab. It is not to actually replace the cervical screen using a speculum and a brush, but rather an option for women who either are under-screened or haven't never screened, who may find having a speculum and a brush either really difficult because it hurts, or they just feel too shame or embarrassed, or for whatever reason that people decide that they just don't want to have this procedure done. There is this option. Now, this option has to be done with like the health professional, so it has to be done in the clinic, but the person can go into the toilet and do it themselves, and all they need to do is pop it inside the vagina and wriggle it around a few times, take it out, put it into its container, and then hand that to the health professional. They will then send that to the lab. Now, if that comes back with no HPV on this sample, then again, that's a good result. It means that you don't have HPV, which means that you don't need another screen for 5 years. If the sample comes back with HPV, it's really important that that person comes back and has, like, straight away, and actually has a cervical screen where they can take the cells from the cervix so that the cells can be checked to see if there's any abnormality, because they've already done this one themselves, which has shown they've got HPV, but they don't have the cells in here, which means that they'd need to have this with the brush and then the cells put into the liquid sample. There is a national cancer screening register. It is actually alongside the bowel screening register. It actually will send a letter to every woman from the age of 25, and it will invite you to start having your cervical screening checks. It will also send you a reminder when your next one is due, and it also has a register that health professionals can either call, or they can use their PROTA account, which is part of their clinical management system, and they can log on to the National Cancer Screening Register to find out a person's history. So they can find out, when their last cervical screen was, what it was there any abnormality there, and so forth. Also, the client themselves can actually also find out their cervical screening history, and they can find that in their MyGov account. So there's the phone number that a health professional can ring. Just remember that if you are ringing to find out your client's cervical screening history, you will need to have the doctor's provider number. And there I mentioned that you can access your own through your MyGov account. So how many women, people with a cervix, are actually having a cervical screen? It actually shows that about 50% of women in Australia are having their cervical screen. That just sort of blows me away a bit, because that's half of the female population are not coming in and having their cervical screening done. And I know it starts at the age of 25 now, but the screening rates are still low. How can we encourage women to actually have their cervical screen? I think this is going to be a real game changer for many Aboriginal Torres Strait Islander women who are reluctant to come in. We know they're under-screened. We know they're at higher risk of cervical cancer, and they're at higher risk of dying of cervical cancer. So definitely, for those women, this may be the way to go, for those women that don't feel comfortable having the pap smear, or sorry, the cervical screen using the speculum and the brush. I think that if you were to know that you had HPV on your self-collection and you knew that you had an issue, then you probably would be more likely to go ahead and have this one done. So I think that even for women, sometimes you need to know, oh my God, gosh, I've actually do have HPV. Okay, I'm fine. I'll go and have this one done now. Yeah. Oh, that's just showing age group. It's still low. Yeah, that's in WA, so still around, 40 to 50% of women are participating in screening, which means that 50 to 60% of women are not. So get the message out there. From the 1st of July, we have the self-collection. Okay, there's going to be resources coming out from the WA Cervical Cancer Prevention Program. So really promote this in your service. It's non-invasive, it's easy, it's also extremely accurate at picking up HPV. Really letting people know, though, that if it comes back positive with HPV, that they will need to come in and have the screening done with the speculum and the brush. So these are some of the resources that are going to be coming out from the WA Cervical Cancer Program. I would also like to acknowledge them and Isha for helping me with the slides for this presentation. There's the contact number for WA Cervical Cancer Prevention Program and also the email there. And the National Screening Register number I've just put up again. Okay, so, I mean, there are all sorts of excuses that we make about why we don't come in and have cervical screen, or why we're late, or why we've never screened, and how can we encourage these women. So really, I mean, and that is different for all different types of women. Can be cultural reasons. There can be reasons that are very personal as well, which would actually stop somebody from coming in and having a speculum inserted. So having this self-collection will hopefully lift those rates up. So from the 1st of July, this is going to be available. So I think another message is not describing HPV as a sexually transmitted infection, because as soon as you tag it with that, there's a lot of shame and stigma that sort of sticks to that. So HPV, it's a normal virus that once we become sexually active, we will all pick up some type, at least one type of HPV in our lives. Most of us will clear the virus. Some of us will hang on to the virus. Some of them are high risk, but most of them are low risk. But why we do this screening program is we want to pick up those high risk types of HPV that could go on and become cervical cancer. So screening is really not about picking up cervical cancer. It's about picking up abnormal cells before they become cancerous. So also, giving those messages as well. Okay, I think my half an hour is actually up, and I think I've actually gone a bit over. Thank you so much for joining. I hope that you've learnt something new. And if you haven't, maybe it's been a refresher for you. Please don't hesitate to contact me. My name is Veronica Walsh. My email is veronica.walsh with an E on the end at ahcwa.org. Yeah, sorry about all the ums. And thank you for joining, and have a really great day. Bye.